This is a KX News special report.
Good afternoon. Welcome, everybody. Thanks for tuning in for our daily press briefing on the coronavirus. We're excited today to have two guest speakers here today from our fantastic congressional delegation who've been working hard in D.C., working on historic legislation. So you'll be hearing from both Senator Hoeven and Senator Kramer today. As we reported this morning, sadly, we had our second death of a North Dakotan related to COVID-19. This was a woman in her 80s from McHenry County, who had underlying health conditions and had acquired COVID-19 through community spread. We announced that this morning just before 10 o'clock. I'm equally saddened to report this afternoon that a third North Dakotan has passed away from the COVID-19 disease. This was a man in his 70s from Morton County. He too also had underlying health conditions and acquired COVID-19 through community spread. Community spread means it was not directly identified back to having contact with someone who had traveled from another area. This reinforces 2 points. One, the sad fact that this is a deadly disease. We had a one-on-one phone call this morning between officials in North Dakota, Lieutenant Governor Sanford, myself, and others, and with Dr. Birx, who's one of the medical leaders at the White House driving this. And again, we had a good discussion about how this is different from the flu. And one of the ways this is different from the flu, the traditional flu can affect younger people. This coronavirus is particularly lethal for people that are older or have underlying health conditions, and in her words, could be up to 15 times as deadly for people that would either be in those age categories and have underlying conditions versus the flu. And the flu is something that we have to be worried about every year, but this is something that's more serious. We know that unfortunately that North Dakota will continue to lose people to COVID-19, and other illnesses. But with every passing, the emotional burden weighs, on those families and on those friends. And as we are all in this together, the First Lady and myself want to send our condolences to those families for the loss of their loved ones, because we know that it affects not only them but the communities and the whole state. But again, this is a harsh but important reminder that we need to take this virus seriously and do our part to prevent the spread. Today, the North Dakota Department of Health confirmed 11 additional cases of coronavirus disease. That puts us over 100 cases. We're now at 109, and that's plus 11 from yesterday. 19 have been hospitalized, and as we just said, 3 deaths. We've been stressing for weeks about the need to take this seriously. We still, unfortunately, have reports of coming in from mayors and from what's observed on social media and from people that have just seen it over this we had a beautiful spring weekend. It's one thing to get outside and walk your dog or take your time and spend some time alone or spend time with family or go for a family drive. It's another thing, like we had here in Bismarck, reports of, parties that were being held and gatherings along the river, like it was summertime, like nothing's going on. And again, whether that's you're indoors or outdoors, we're requesting don't attend or hold gatherings of more than 10 people. And again, the key here is physical distance. It's not lack of activity. It's not immobility. It's physical distance. So if you can do stuff where you stay more than 6 feet away from people, you're helping to avoid that spread. And of course, we restricted access to schools, closed businesses. Lots of people are taking disruptions to their lives. With the mandatory closing of business, that's causing enormous economic hardship. And so again, we would ask for those individuals, as out of respect for the people in the state that have the economic hardship, and out of respect for the over 20% of the people in our state who fall in the category of being vulnerable, that we would really want people to get educated, understand how serious this is, and continue to practice what we've been talking about in terms of this. From the spread across the state, it's touching now every county. I guess we have 2 counties that don't have a positive test yet, but we have to assume that this is everywhere in the state. There were some questions earlier when we started out, when we had more of a hotspot in Burley County early than Cass, but now testing in Cass has surpassed Burley. And we do know that not included in these numbers is over 300 pending tests in Cass County as they continue to work their way through the backlog that they had with Quest. When we take a look at total cases, again, we had a big spike up 2 days ago. We had a little reprieve over the weekend, back up again today, as we say, bringing those total cases up to 109. We need to look at this trend line on this slide, which shows this upward slope, is the one we need to pay attention to more than the variability on day to day, because that varies a little bit on number of tests per day as well. So when we people have asked us sometimes about, well, if this is serious, why aren't you doing more? Why aren't you locking it down? And which is a phrase that we get asked about. And I'm not sure what lock it down means in terms of people thinking that somehow, we could start putting roadblocks on our borders. I mean, take a look in your grocery stores that are vital to keeping our state going. Just about everything you see in those stores is manufactured in another state. And so we've got to keep those supply chains going, whether it's food or medical equipment. So we have to keep that open. And without testing, a roadblock doesn't do any good if you can't test everybody at the moment you stop them at the roadblock, because you can be asymptomatic. You can not have symptoms and you can still be transmitting this disease. So the key thing for us to do is not to have more government mandates. The key thing is to have individual responsibility, which in our state, and again, that's what's going to slow the spread down, is individuals following the orders that have already been given so that people have an opportunity to, again, slow the spread. Why are we slowing the spread? We're slowing the spread because that will preserve the capacity we need in the healthcare system to allow us to serve those people that might find themselves needing ICU care, needing ventilators, needing those critical care trained staff as trying to do. And again, we continue to work around the clock to raise that hospital capacity as we work to flatten the disease curve so that we can keep those 2 lines apart. And by doing that together, we save lives. So again, some of the basics that we've talked about, again, if you're not feeling well, definitely do not go into public. Don't go into social situations. Don't go to work. Stay home. If you are someone who's tested positive, absolutely positively, you should be in self-isolation for 14 days. If you're living with someone who's tested positive, you should be in self-isolation. If you know someone who took a test and that test is pending, you should presume the test is positive and you yourself should place yourself in isolation. Because the way we slow the spread is when we've got known cases or people who are known to be with known or presumed cases. Those are the people that it's especially important that they're not in contact with others, because, again, trying to balance what we're doing here when we're talking about saving lives is important, but the people that are closest to those who are known to have the disease, you're the folks that are most likely to be in a position to be a spreader, and so it especially applies to you. Now, there's also been some discussion about is this about saving lives or about helping the economy? I think this is a totally false dichotomy, a false dichotomy between the saving lives and saving the economy. Why is it a false dichotomy when we put those 2 against each other? Because what happens when we have a strong economy? When we have a strong economy, more people have jobs, more people have health care, more people can afford to get great health care, more people can afford to have safe and stable living environments, more people are employed. When people are employed and are working, they've got less anxiety and less depression and less stress. And so the whole world benefits, and our whole world from a health standpoint benefits when we have a strong economy. So we got 2 things going on right now. We're going through a period of extreme and rapid economic slowdown. At the same time, we're fighting a global pandemic. The good news is that we're all Americans, and America has got the strongest currency in the world. We've got institutions that allow us to mobilize enormous financial resources at a time like we've never seen, like not during the 1930s, during the Great Depression. We've learned some of the lessons and failings from the 08 and 09 financial crisis when some of the efforts there were too little too late. And I want to compliment our congressional delegation for their leadership in moving quickly and moving with significant speed, with significant capacity that's going to help every American. And I would say their work is not done. I know that our leaders are planning to go back and continue to look for ways to continue to help and support our strong economy, because when we have a strong economy, we're also saving lives. So with that, I'm going to introduce to the podium the first of our two senators that are here today. So great. We're so fortunate in our state to have senators that are so close to the people, so accessible to the people, and so still connected to our state. And so we got 1/50th of the U.S. Senate here in the room, but they're more than 6 feet apart, which I'm happy to see. Okay, so Senator Hoeven, if you want to come on up first, would be fantastic. And thank you again for everything you're doing to get the CARES Act passed.
Thank you, Governor. Thanks for your strong leadership, and thanks to the people of North Dakota for their common sense and their strength, and I know that they're doing just a fantastic job. And, you know, as our country works through this coronavirus, I know that, you know, we have to follow all the proper precautions to first defeat the virus and then open things back up and get our economy going, get people back to work. But I have no doubt that North Dakota will lead the way in that endeavor. So again, thanks not only to Governor Burgum, but to all of the statewide officials, legislators, local officials, and again, just the people of North Dakota for that common sense and wisdom. And no question, people are doing a great job and will continue to lead the way. I want to thank Congressman Kramer, Representative Armstrong, and Senator Kramer as well for their diligent work, not only on this CARES Act, which I'm going to talk about for a few minutes, but also, you know, for being here and doing everything that they can to help implement it. Because the key is we have it now, and we're going to talk about that for a minute, but the key is making sure that we get these programs that I think will be of real assistance going as soon as possible for the people of North Dakota and the country. So let me start with, I'm going to give an overview of a number of these things. I'm not going to cover all of them. And then Senator Kramer will probably go into some more detail on some of them and then cover maybe some of the programs that I don't. The one that I think people are right off the bat asking about and looking for, and I think Governor Burgum's talked about a little bit, is the checks that will be coming out. And you may have seen, but Secretary Mnuchin yesterday said that within 3 weeks, those checks will be out. If you get direct deposit for your tax return, then it will go direct deposit to whatever account you've got that set up on your 19 tax return if you've already done it, or your 18 tax return. And of course, that is income tested, so if you make $75,000 or more, it starts phasing out. But for $75,000 or under, it's $1,200 for an individual. Obviously, for a couple, that's $2,400 with an income limit of $150,000. For single head of household, it's $112,500. So $1,200 a person. So like for a family of 4, it's also $500 for children. So for a family of 4, that'd be $3,400. So that's basically how that program works. Now, if you didn't file a tax return, you may still be eligible, okay, as long as you have a Social Security number, you're not a dependent, and you have a work-eligible Social Security number. If you have any question about whether or not you're eligible, you can go to irs.gov. Now, they may not have the full website activated with all these details yet, but they will. And so you can check in on that website and find out. And you know, you may have to apply if your income was below the payment limits, but they'll have directions there on how to do it. So that's one that I think people are very concerned about, because for those that can't go to work because of the precautions that we're taking, they want to be able to replace that income. And so that's what that payment is all about, is making sure people know that they're going to be able to replace that income. The second thing I'm going to talk about for just a couple minutes is the ag piece. I chair ag appropriations, so I was very involved in writing this, as well as securing the funding. We secured about $25 billion in the ag piece to help not only our farmers and our ranchers, but also make sure that USDA Department of Ag can help keep that whole food supply, that food chain going. Governor referred to that, how important that is. We not only feed the United States in this country, our farmers and ranchers, we feed the world. And so we got to make sure that we're helping get those farmers and ranchers through this COVID-19 virus and the shutdown that we have while we're fighting it. That involves a number of things, not only making sure that they're able to have funding to keep their inspectors on the job and the people at USDA that work every day to make sure the food chain, the food supply is working, but also actually help for our farmers and ranchers. As you know, they were having a very hard time before this virus hit. And we'd worked to help them with a number of programs, the market facilitation payment, and also disaster assistance. Matter of fact, we're still in the process of getting disaster assistance out. That's in addition to the Farm Bill. But in this legislation, we were able to include $9.5 billion, in essence, as emergency funding, and another $14 billion to replenish what's called the CCC, the Commodity Credit Corporation. So together that's $23.5 billion that in essence becomes available to go to our farmers and ranchers to assist them now through this period. I was also able to add language that includes livestock and our cattle ranchers. Under the CCC, we were having problems getting that assistance to our ranchers as well. And they have been hit very hard as a result of this virus, and they were having real challenges before then. So this ag piece is, I think, very important, and it's something that not only have we worked on directly, but we're going to need to continue to work on directly, because what we have in the legislation is the funding and the authorization to provide help through the Department of Agriculture. Now we actually have to design or develop the program with USDA. So what I'll be doing probably over the course of this week, if I can get it pulled together soon enough, is we'll get all of the ag groups together and we'll give input. And I'll have people from USDA involved in that teleconference as well. I just got off the phone with the Deputy Secretary of Agriculture, Steve Sensky. I've talked to the Secretary, I don't know how many times, and everybody else. But now we will give the input to USDA as to how we put that program together so that it's fair, certainly so that it helps our livestock producers who really have been left behind on this assistance. They've got some market promotional funds, but they really haven't got the assistance that our other producers have. But obviously it involves our farmers as well as our ranchers. But now we need to put this together so that we can get it out, obviously on as soon as possible. And I'll be pulling, like I say, together teleconferences to do just that. The small business program is the other one I want to touch on for a minute. This one I think is very important because it's not just loans to small business, it's really a grant program. And it works through the banks and all of the financial institutions. So banks, credit unions, all of our financial institutions. It's administered by the SBA, and even though your bank or credit union might not be an SBA lender today, they can still get authorization from the SBA to do it. And SBA is hopeful that by Friday they can actually start approving loans under this program. And they'll be getting that information out on their website right now to the banks. We're probably going to have to coordinate some teleconferences as well with the banks and SBA, maybe the State Chamber of Commerce, the Gov's office, and so forth, to provide more of that information. But the key, and the reason this goes through the financial institutions, is to have a lot of points of entry for small business. So you're not creating some kind of new bureaucracy or overwhelming some government agency. Again, this is that public sector, private sector approach that, I'm very fond of. I think it works very well. And the idea is, you know, everybody's got a financial institution. Now, small businesses can go in to their financial institution and get this assistance. Businesses can borrow up to 2.5 times their average monthly annual payroll, 2.5 times. And to the extent that loan is used on qualified expenses, it's forgiven. Okay? In other words, you don't have to pay that back for any qualified expenses. So what does that mean? That means for your payroll, when you keep those employees on the payroll, that expense is forgiven. What's the point of that? To keep those people employed. You may be shut down. Normally you lay them off. This is to keep them attached to the business so those businesses stay together and they can get up and running as soon as they can get going again after this time where they're shut down because we're fighting the virus. Other qualified expenses include things like interest on the mortgage, interest on any other debt obligation, rent, insurance payments. Okay, so those qualified expenses are in essence a grant. So this is something that we think is going to be very important and very helpful for businesses, but also for employees because it will keep them employed. Okay, a couple other kind of larger umbrella points. For people who are laid off, we're doing more with unemployment insurance so that the state has the funding, because I'm sure the governor's talked about the tremendous number of unemployment insurance claims already. And obviously they're going to have more. So we're providing funding to make sure that the state, that unemployment insurance fund is there, along with extending a number of those, both increasing and extending a number of those benefits. So that's very important as well. So people know that hopefully we can keep as many as possible tied to their business for the good of those workers and the good of the business. If not, that unemployment insurance is going to be there. And it's also extended to people who typically don't qualify. For example, some of the self-employed, independent contractors and those kind of things as well. Two other big points, $127 billion for hospitals and healthcare institutions. And we're still working with HHS to develop exactly how that works, but we'll continue to press along with the governor and others to make sure that it is responsive because, you know, particularly in North Dakota, we've got those critical access hospitals and a lot of rural health care, teleconferencing, and all those things. We want to make sure that that money is delivered in a way that can be used here in North Dakota. So again, a lot of this is getting the funding, but now we've got to get it deployed as quickly as we can in the way that is the most useful to fight the coronavirus and help our citizens. The last point I would make is that we also included funding in what we called the Coronavirus Relief Fund. That's about $150 billion, well, it's the second to last point I'm going to make. $150 billion Coronavirus Relief Fund. Of that, North Dakota will receive $1.25 billion. And again, we want to get you as much flexibility as we can. Gov, you and I've talked about this a number of times. This is in addition to block grant money. This is over $1 billion for state of North Dakota for you and the state to battle coronavirus. And so again, we'll try to get that, get you as much flexibility as possible, but obviously that's a big shot in the arm for you. And then, in addition to chairing Ag-Appropriates, I chair Indian Affairs. I think this is a very, very strong package to help Native Americans as well. It starts with an $8 billion stabilization fund, which will be delivered to the reservations. We provide over $1 billion for the Indian Health Services, more than $400 million for BIA, for law enforcement, more than $300 million for housing, and more than $300 million for Native American education assistance, along with flexibilities. And again, in our office, we worked very hard on the overall package, but we also made sure that on reservation, Indian-owned, tribally owned businesses, as well as individually owned businesses, qualify for the loan programs. So that SBA Small Business Loan Program I talked about, really important. Again, 500 employees or less, but when you look at the casinos and some of these tribally owned businesses, they're going to qualify for that assistance as well. So we had to write separate legislation for that because of tribal sovereignty and so forth. Okay, so that's kind of the summary. Gov, thanks again for giving us this opportunity to present along with you, but most of all, thanks for your strong leadership. Appreciate it. Can we do this?
Stick around for Q&A.
Okay, we can do that, right? Okay.
We're so fortunate to have two senators, both who've worked in state government. Senator Hoeven, obviously very comfortable at this podium, which he stood behind for 10 years. Thanks for your leadership. But Senator Kramer, likewise, with decades working at the state level, really understands North Dakota and its people and its businesses, and serving here as part of the Public Service Commission before Congress, before Senate. But great to have him back, another individual just fighting for North Dakotans every day. So here he is, Senator Kramer.
Thank you, Governor, and to your entire team for the incredible work you're doing. And it's been a great partnership. I know my team and your team are getting to know each other really, really well. So thanks for being so accessible. I might just say right up front, by the way, I did print the bill out and brought it with me. It's right over there for those of you in the room. I thought about putting it up here, Governor, but it might have tipped the podium over. So if you've never seen what $2 trillion looks like on paper, it's right over here. Let me say also right up front, and share from Chris and me our condolences to the families who are losing people to this awful disease. It's a horrible sacrifice, but we're grateful to everybody who sees these examples and demonstrates the type of care that you're asking them to, Governor. And this is real. This is real. And we need to treat it as such and take the precautions that you and others are asking of us. I also would say early on, before I forget, that while I did print out 880 pages, for those of you who want quick access to other resources, my website, kramer.senate.gov, we put a /COVID-19 page so that you can go to that. There's a lot of the frequently asked questions on there, access to the IRS and DOL, Department of Labor and Health, and all of the other agencies so that you can get to that quickly through our website. And we try to update it as quickly as possible. Senator Hoeven did a good job of giving the broad overview of the bill. The bill kept growing both in cost and size because the demands were great and are great, and they're continuing. And in a future, one of these, Governor, we can maybe talk about Phase 4. There's a lot of talk already beginning there about that. I might just add a couple of things that the Governor was talking about. I spent a lot of my personal energies on the bill focused on that small business piece of it, the 500 employees and less, the Paycheck Protection Act, the grants disguised as loans. We were very strategic in making sure that the distribution of the Paycheck Protection Act were the community banks, but I also want to include credit unions and in many cases the farm credit services. They were left out in the early stages. And this might be a good time, frankly, Governor, to thank you and the community banks and credit unions, the lenders in North Dakota who were very engaged with us on this. As a member of the banking committee, I heard from all of them often. And your shop, I want to especially compliment Michelle over at Department of Commerce for facilitating the webinars. I had the opportunity to talk to over 400 lenders last week because of that, and 90 plus the week before, thanks to the North Dakota Bankers and Independent Community Bankers and the Credit Union Association, to walk them not only through it, but then to get their feedback to fix the bill so that it was more accessible to more people. And not surprising, having been an old economic development director for North Dakota, not surprising, our community banks were more up to speed than most on being SBA approved, SBA certified. Our credit unions are getting there very quickly. We were able to get ahead of the curve because we were ahead of the curve. And some of our other ag lenders, Farm Credit Services in Mandan, Minot, Grand Forks are also all SBA approved. So if you haven't already and you're a small business and you've got expenses, payroll expenses, this is retroactive to February 15th. If you haven't already started working with your banker, start working with them because, as Senator Hoeven said, Secretary Mnuchin, as recently as this morning, When he was saying it last week, we were doubtful. As recently as this morning, he said he wants to have that money in the hands, or at least the rules in the hands of the bankers by the end of this week. So he's sticking with that. Those expenses that the governor, that Senator Hoeven laid out are covered. Those basic monthly expenses, and can be turned in for a grant. I also might add the 500 and fewer employees question comes up a lot, because there are certain NAICS codes that where the number's greater than 500. So if you have an associated code, you may very well, and this is especially true of our energy producers in the Bakken, you may very well qualify even though you have more than 500 employees. The governor covered several of these other things. I might add just one other thing, since I brought up energy. And John's exactly right. We're working with the administration now on the implementation of a lot of this. But during the middle of this coronavirus issue that has lowered demand, obviously, for oil, that's had a tremendous impact on the prices. On top of that, our so-called friends in Saudi Arabia have engaged in a price war with our adversaries in Russia. That has had a devastating impact. And I know you're going to see it, Governor, in revenues. And a couple of us, Senator Sullivan from Alaska and I, have sort of led the charge on behalf of energy-producing states, and in a less than probably diplomatic way for some, in challenging OPEC and our Saudi Arabian friends, and a number of things, and I won't go through them all now, that we've engaged in. Happy to answer questions about it. But I did just this afternoon get off the phone and had a long conversation with the State Department, the Assistant Secretary of State, Fallon, who's the Assistant Secretary of State for Energy, and I had a long talk about their diplomatic process. I've been glad to provide some muscle behind the diplomacy to make sure that Saudi Arabia understands I'm not going to support 2,500 of our troops in Saudi Arabia, or 4 different missile defense batteries in Saudi Arabia that are protecting Saudi oil assets rather than protecting American soldiers in places like Iraq, when these friends of ours are basically waging war on our industry and our jobs and our workers in this country. So glad to answer more questions about that as well if necessary. But I think Senator Hoeven's covered most of the high marks, and happy to answer questions in the Q&A.
Thank you, Senator Kramer. I'll cover a few more items, including some executive orders before we go to Q&A. But let me just say, to sort of capstone the CARES Act and the remarks of the 2 senators, each one of these components that was discussed today by itself would be historic legislation. The SBA loan program, forgivable loans, never before seen, without precedent, going to be fantastic, relief for a lot of organizations of many sizes. So we got that. Almost the doubling of unemployment insurance. State of North Dakota, typical would be $600 a week. What we're talking about on the federal is another $600 on top of that. That's $1,200 a week. You multiply that, that's a run rate of over $62,000 a year. So we're not only talking about relief, we're talking about Lieutenant Governor Brent Sanford, and I actually think that it's going to become competitive because people might actually be in a position where they could make more money on unemployment with a bonus than they could working. We'll see if that comes to pass or not in the months ahead, but that's a super generous thing, and we're really glad to have it for those people that need it. The direct payments of the $1,200 per individual plus $500 per child that Senator Hoeven covered, again, never had anything like that. So each one of these alone, standalone, would be incredible, and the over $8 billion going to tribes, which I know that Senator Hoeven advocated for, is also something that really is really incredible. So again, we thank them for all of their work, and we know that's going to make a big difference for North Dakotans. I signed 3 executive orders today. First one is an amendment related to school closures and the implementation of distance learning. We got great things happening on that front in terms of all of the programs or that were proposed programs have all been submitted, and we have almost 100 of those have been approved. We're still working our way through the remaining 75 of those through tonight and tomorrow, but good things there. When we talked about childcare last week and supporting childcare, one of the things that's emerged is there are a number of school districts that want to be participating in providing childcare for lifeline workers, and so the amended order allows certain public school districts to open facilities for the limited purpose of providing child care services for children in K-5 only, and for K-5 teachers, for the children of K-12 teachers and other health, safety, and lifeline worker households as identified by Department of Human Services. So that's an amended order. Indefinitely, schools are still closed for general academic purposes, but for specific schools that are applying to deliver K through 5 childcare during the day, we can use those facilities again following the new standard operating spacing agreements that we released for childcare operators. And of course, the childcare operators in the state support this because normally this time of year they wouldn't have kids in that age group of sort of 6 to 11 wouldn't be in their childcare facilities. They would be in school. We also signed an executive order that came out of a phone call that Lieutenant Governor Brent Sanford and I had with all of the mayors from the largest metros across the state on Saturday. And from other inputs, but one of the things that's required in state law is that even if you're having a city meeting, and that could be a park board, a city board, a township board meeting, that the open meeting requirement that stands on the books in North Dakota requires a physical meeting room, and as well as other electronic means that you might be using, like Skype or Zoom or dial-in speaker phones, monitors, but they were required to have a physical location. This isn't possible in some places, and in some places it would violate other rules. So during the period of the emergency by executive order 2020-16, meetings of a governing body where members appear by remote means, they must provide conference dial-in, they must provide electronic link, they must provide real-time or live stream public access, but they do not have to provide a physical location in addition to all of those things. We actually think this will increase transparency because we had learned that some cities weren't holding meetings because they didn't want to have the public access. So we think this is actually going to help transparency during this period versus restrict it. And the third executive order has to do partly with agriculture, but there are a number of permits and deadlines which are overseen by our Department of Agriculture and Commissioner Goring related to livestock auction licenses, pesticide application licensing. So our executive order 2020-17 extends the deadlines for applications. So if you had a valid one previously, you could continue to keep operating. And then there's also in there related to public libraries in our cities around the state. They were under a deadline of March 31st to submit state aid applications. That's been extended out to May 31st. Okay, unemployment. This was mentioned, the totals over the full weekend, numbers were 2,944 claims came in over the weekend. Claims so far today, 1,449. That means the claims over the past 12 days is now closing in on 21,000. The sum total of the numbers we've given you before is 20,916. Just to put this in comparison, when we were operating in 2019 as one of the states with the strongest economies in the country and the lowest unemployment, for the entire year of 2019, we processed approximately 20,500 claims. So we've had more claims in the last 12 days than we had during the entire year of 2019. So again, we keep sharing these websites, jobsnd.com or the automated phone line, 701-328-4995. I'm sure there'll be more calls and questions with the passage of the CARE Act, which adds a federal component on top of the state component. We encourage people to call there or check that website, but we also encourage people to have patience, understand that we are ramping up and moving more personnel over to work to support all the activities there. But again, we got a team of people that in 12 days have had more than a year's worth of work come at them. So we'll keep working on that. with that, I'm going to stop and we'll take questions, and they can be directed to myself. We've got Eileen Tufte here from the Health Department. General Norman is here from Emergency Services, our 2 senators and the Lieutenant Governor. But since we're probably only going to have the 2 senators today, this would be a good day if you want to ask them questions directly to either of those 2. Let's take advantage of them being in state. First question goes to James McPherson. We're glad to have you back on the job. We've missed you the last few weeks, but you look good, and we're glad to have you here.
Thank you, Governor. Several groups are urging you to issue an order blocking evictions and foreclosures. Can you comment on that, please?
The question was several groups are requesting that we block evictions. Let me start with the work that we've already done. I want to make sure we get the word on that. Last Monday at the Industrial Commission, we did through the Bank of North Dakota, which has a set of mortgages. They adopted the same set of rules that HUD, Housing and Urban Development, has. Housing and Urban Development and our North Dakota Public Finance finances low-income housing across the state. And we adopted the same rules for those 3,000 low-income units that we have in North Dakota that are financed through North Dakota Public Finance as HUD did. So that we've already, for the people that were likely most in need with low-income housing, did that a week ago. There's been a lot of input that's coming in from lots of different groups, from some homeless coalitions, from our major cities, from different groups that are piling in. I just want to say for the rest, for the ones we haven't already taken care of, because I think some of the input we're getting, we need to get the word back to them that we've already got you covered. For the rest of the groups that aren't covered, we want to do 2 things. We want people to have an opportunity to absorb the enormous amount of money that's coming, both in terms of the direct payment checks to almost every American, and the enormous amount of unemployment insurance. I mean, this is in some cases not only going to make up, it's going to more than make up lost income. So what we want to do is really be thoughtful before we issue a broad order for everybody in the state of North Dakota, because we might be creating a bigger problem than we'd be fixing, but we're going to get a chance to sift through all that. But I would say that at least so far, kudos to those groups if they were trying to get our attention. I've gotten more emails on this topic than any other single one, and so I think they're well organized, and we hear you, but we're trying to sift through it. Part of that sifting through is Chris Jones, who leads Human Services for the state of North Dakota. We are going to be setting up a call with all of the homeless coalitions from all the states, because good health starts with stable housing. We understand that. Some of these letters are very emotional. Let's not be throwing people out at a time they lose their housing during a health crisis. We absolutely, positively don't want to do that. We also don't want to unnecessarily disrupt. I mean, our economy is so disrupted. For those people that can pay their rent on April 1st, we'd like them to pay their rent. Because the people they're paying their rent to have also got employees and mortgages and all of that. So we're trying to keep liquidity flowing, whether it's the Bank in North Dakota, whether it's the direct payments, whether it's deferring the April 15th tax deadline to July, which we talked about. That's $300 billion of liquidity, North Dakota doing that. People may be in better shape than they realized, based on getting a full understanding of the enormity of the CARES Act that's just been passed. But having said that, we care a lot about stable housing in this state. We know that it's important. We know that it's a component of health, and we'll continue to try to define this problem more specifically and see if there's some targeted things where we can provide relief. So we haven't given up on this one, but this is in our closely watched bucket. Jacob from KFIR, welcome back. You've got perfect attendance here, I think, for all these.
Thank you, Governor. In reference to the schools that still have to have their plans approved, when the deadline first came out, you said that schools that didn't have the deadline or have that plan in place for Monday, there was a possibility that their school years might be extended. For the 75 schools that haven't had their plans approved yet, what are those schools doing now, and what should they expect to make up time?
The start date for people delivering distance education was April 1st, which is Wednesday. So we're continuing to pour through those all through. We'll go keep teams of people going through tonight between the governor's office and DPI. Over the weekend, if we saw gaps in people's plans versus just sending them hey, on a pass-fail, hey, you didn't make the cut, we're sending them back. Here's the areas where we would like to see more development done. In some cases, that was as simple as a phone call, and they said, oh, great, we can send you that. Hey, it's up on our website. But we want to get really clear about what the expectations are for students, and we want to get really clear about what the expectations are for teachers. And that was the area that we're putting the most focus on as we go through these plans. But I would also tell you, as expected, and thank you to all of those superintendents and teachers and innovative folks and school boards. I mean, in the first 100 plans, there's a lot of really great stuff that is happening, and people are coming up with new ways and new approaches. I've been personally getting people sending me stuff and saying, hey, my third grader just got their distance plan and they're all excited about it and the kids are ready to go. So I think that we're going to find out that we can learn some new ways and new approaches, and it'll be great that our schools are going to be all teaching again by Wednesday. For those that haven't been approved, we're optimistic that we can give them the feedback and get plans approved in the next 24 hours. That's our goal. And if we end up with a few that are short, then again they'll have the option of, say they start next Monday instead of this Wednesday, then they just have to add more days on at the end of the year. Dave Thompson.
Governor,
and then you, Amy, after that.
You have been mentioning all the counties where people have tested positive for the virus, or maybe in a hospital or something like that. Are you thinking at all about listing the counties where people have recovered? And South Dakota apparently is going to do something similar.
Okay, we got a question/suggestion about could we list where people have recovered? We'll just take that one as under advisement, and again, we're trying to walk this balance between all the transparency we can and personal health information. But as we go through this, I can see why that might be helpful. We'll take a look. Amy, and before you ask your question, I'm just reminding we've got a couple of senators here which aren't going to be here any other day, so want to make sure these guys are earning their federal paychecks.
I do have a question for you. I also have one for Senator Kramer, but they're completely different. Okay. So, first for you, there's some research out of the University of Washington that shows that North Dakota is projected to have an adequate number of both hospital beds and ICU beds over the course of the next 4 months, and that our peak demand on hospital resources would fall on May 1st. Are those projections anything that North Dakota is using in its modeling, or does that kind of fall in line with the modeling that we're doing?
I'm just going to assume that Amy was close enough to the microphone that everybody can hear that, but this is the IHME modeling, and I'm glad you're looking at it. We have looked at lots of different models. You heard me last week express concerns about models that some of neighboring states were using. The IHME modeling is, we think, directionally correct in terms of in terms of how it's working. In our phone call, the one-on-one call we had with Dr. Burks this morning, she expressed again of the what's now turning into be hundreds of different models, that this is one that she had more confidence in terms of having the right kind of assumptions that are built into there. So we like that. 171 deaths, that's not acceptable to us. I mean, we 2 more today. We do not want to be on that path. We want to be below that number, but that certainly is certainly a possibility for the state of North Dakota. In the things that they list on there, because you can click by state and look at that, it shows that we've got a little bit of gap between what's available and what's not. We think that some of their numbers in there, all of you here in the press corps have asked about ventilators. We think the ventilator number is too low that they've got on their site. ICU beds maybe doesn't reflect our tier 2 capacity of being able to create more. So, we think the deaths are too high in that model in terms of what we would be acceptable. We also think that the hospital capacity that they're estimating, it shows us as being better prepared than most states. We're not satisfied. We're not trusting the model to say, oh, we got enough because we got 6 or 10 beds to spare. Based on what's going on in New York and other locations, we don't think that's we would want to have a larger margin of error than using somebody else's model, because we don't want to be playing with lives with that. So we're going to continue to drive our health capacity up, even as we try to drive number of fatalities down. But directionally, we like the model, but we're continuing to work in refining our own models, because then we can make sure that we're making sure we've got North Dakota specific inputs into how we're doing that modeling. And I believe the next question is for one of the senators.
So I wanted to ask you, Senator Kramer, about oil, some of the work that you're doing specifically about oil right now. And, you just alluded to some of the work that you've been doing trying to, press Saudi Arabia on these issues. Have you seen any success and progress on their part in moving that direction?
Yeah, I would say, thanks for the question. I would say the most successful thing I've seen is the president's tone this morning after his call with Vladimir Putin was encouraging, because if you couldn't tell, I was sensing some, I don't know, I guess passiveness about that from the administration. Obviously, low gasoline prices, everyone loves them. If you could only drive somewhere, they'd be great. But it's not much of an economic boom when there's nowhere to go. So I think that the president reaching out to the Crown Prince was encouraging. When reaching out to Vladimir Putin was encouraging. Probably one of the most encouraging things was last week, Secretary of State Mike Pompeo called the Crown Prince of the Kingdom and had a strong conversation with him. I will tell you, however, that at $20 roughly a barrel, there is real urgency to this. And so I've pressed everybody from the White House on down on the matter, including I helped set up a phone call with the Saudi ambassador to the United States. Senator Hoeven was on that call. There were not many punches held back, Senator, as I recall, including his. And we've had constant contact with our ambassador. I also, just to add a little bit to it, some of the other things we've done is I led a letter to the president suggesting a embargo of Saudi oil. I wrote a personal letter to the president asking him to consider tariffs on OPEC oil. Just in case people wonder, I know we're energy dominant, we're a net exporter, but we do still import about, roughly 6 million or more barrels of oil per day from other countries, including Saudi Arabia. I learned last week from a company that a major U.S. company is changing their refineries to accept Saudi Arabian oil. That's not okay. This is an America First battle cry. And so I think we have to use these emergency powers to insist that not only our producers, but that everybody in the value chain understands the importance of this. So, but the most encouraging thing is that the president seems to have stepped up his rhetoric a little bit and his demands of the Crown Prince, or of Vladimir Putin, I'm sorry.
Senator, I actually also have a question referring to some of your wording earlier. You referred to Saudi Arabia as friends. National intelligence agencies say that they've killed Americans and gone relatively unpunished. How is Saudi Arabia our friends?
Yeah, so really great question. And the question was, how is Saudi Arabia a friend? I referred to them as a friend. They are considered an ally. They're a very important ally in the Middle East when it comes to certain bad actors. They've been helpful in the war on terror. They've been especially helpful in the war, or in fighting back against Iran's aggression. But they're a reluctant ally, in sort of a circumstantial ally in many cases, shall we say. I told the State Department today, do not bring another bill to the United States Senate that in any way advocates for Saudi Arabia or suggests or opposes or asking us to oppose legislation aimed at either condemning or punishing Saudi Arabia. Being their friend is a tough place to be sometimes. And like I said earlier, we are literally putting American military men and women in harm's way to protect oil assets in Saudi Arabia while they wage war against our oil assets and our oil jobs in this country. And it shouldn't be tolerated.
This one's for you and for Senator Hoeven. I'm just wondering why you guys aren't self-isolating after coming back from DC when Representative Armstrong is.
Well, so great question. You're close enough to the mic, maybe they heard it. Why aren't we self-isolating? So a couple of reasons. First one is, at least at the time we left there last week, Washington, D.C. wasn't a hotspot. I don't know if they are listed as one now. They're not. So they're not one of the states / territories / districts, I guess, that's problematic in terms of traveling from there. Second of all, I think Representative Armstrong had to endure a very unfortunate situation in having to go back to vote with a number of his colleagues. The Senate is only 100 of us to begin with. We were pretty much exercising self-isolation while we were there, voting by, just like we are now, staying 6 feet apart. Social distancing was well exercised in the United States Senate while we were there. And Representative Armstrong had to, like I said, go back and vote in the chamber thanks to the reckless behavior of one member, somebody who should have known better. And so a couple of hundred or more, they had to have a quorum in the room to vote. They all had to be in there at the same time to vote. Even a voice vote required that. And so I think out of an abundance of caution, he's doing the appropriate thing. We didn't have the same circumstance. John can answer more appropriately.
No, Kevin's right, but also, for example, I talked to the Senate physician. After Senator Rand Paul was, it was determined, his test came back positive that he had the coronavirus. I talked to the Senate physician and I said, okay, his test came back positive, what should we be doing on this? And so he took me through a series of questions. Okay, have you sat with Rand Paul recently? Did you have lunch with him? Did you ride in the car? Did you talk to him? All these different things. I said, no, that's not the case. He said, okay, then unless you develop symptoms of some kind or feel sick at all, then no, you don't need to, sequester or to get a test. He said, but if you start to feel any kind of symptoms or whatever, then you should self-quarantine and get the test. So it's on the advice of the Senate physician. That's how I've been handling it. And I think that's how most of the senators have handled it. Also, Amy, you might take a look at a press release I put out on Friday on oil. I talked to, not only have I about directly intervening, also Secretary of the Treasury Mnuchin and Peter Navarro, but then on Friday, both with the Secretary of Energy, Dan Brulette, and also with Larry Kudlow. And I think over the weekend, they really, discussed this very seriously, and you saw how the President has come out now. And the point is this. We're fighting the coronavirus, so demand's gone way down. You've got this price war going on. We need the President to press Saudi Arabia, Russia, and get it stopped now. Oil is at $20 a barrel. This is not a long-term deal. This has to happen now. And the President has weighed in very vigorously, and so we're hopeful. And this is about thousands of workers in our state that are out there every day. And keeping our industry is vital because that's what ensures that consumers have long-term, low, stable gas prices. But if OPEC and others, Russia, Saudi Arabia, can drive our business out, that's when the price spikes up. So not only does that disadvantage consumers with gasoline prices at the pump, it puts all of our great workers out of work, not only here in North Dakota, but throughout the energy sector of our country, and it's ultimately a national security issue. Vitally important we have that energy. So this is something, Congressman Kramer's been a real leader on this. We don't have time to go pass a bill on this. This is one where the administration needs to weigh in. These countries need to work with us, and I think you're seeing that action now. And we need it for all those great workers we have in the energy sector.
I have a question about the CARES Act. Will those who receive Social Security checks receive the $1,200 checks as well? And
yes.
Does the CARES Act, it does, and does it address any other Social Security benefits?
Well, Social Security recipients are eligible to receive the checks. If you're a dependent, you don't. And so anyone else that has what's called a work-eligible Social Security number, even if you didn't earn it on your 2019 or your 2018 tax return, you're still eligible for that check. And then the $500 check is for anyone under 17 and under that's a dependent, okay? So this is really important for some of those situations where you may have a student, for example, you know, that's out of work, that didn't have enough income to file a tax return, but they're too old to be a dependent, they're going to be eligible. Now, think how important that is, going back to McPherson's question about paying rent. And as you know, the president has already asked HUD and the other agencies now to provide, in essence, a moratorium. But we certainly want all landlords working with tenants. Look, the income's coming. They're going to have that income, so they would be able to pay rent and that kind of thing. So I know, Gov, we're hoping that this is about all of us working together.
Question online, who's it for, Danny?
For the senators.
Okay, and then after Danny, then we'll go to one to Lane.
Tom Simon with Trending
Our
Topics.
team absolutely would have had the national championship this year. No doubt about it, right? I can see you're wearing a hat.
Tom Simon with Trending Topics in Williston. We've been advised that there are just over 408 ventilators in the state. Is there anything you can do or are doing to help get equipment and PPE to North Dakota?
Yeah, there's $16 billion in the bill for PPE, okay? There's $100 billion in there for hospitals. And also the president now has used the Defense Production Act with General Motors and others to build more ventilators, to get more equipment, and there's a whole series of companies now coming online that are working to do everything from face masks to protective gear, ventilator parts, ventilators, all those kind of things. So this is being mobilized both through funding, through the Defense Production Act, and then this voluntary public sector, private sector partnership like we're doing on the testing. And that's very important. It's not just about, you know, the government, federal, state, and local, but engaging private enterprise to work with us on these solutions and actually, you know, deliver the solutions.
That's perfect. Yeah.
I was going to add on the ventilators. We've given our team the charge because we know if we have the peak here in our state comes at a time when the rest of the world is peaking, we can't count on getting ventilators shipped here from someplace else, whether it's out of a federal stockpile or from whatever. So we are engaging with private industry to drive that forward. And right now we had a communication with the CEO of Apario in Fargo. They're going to convert some of their production, their precision manufacturing organization, you know, led by Barry Batchelor and his son, Dave. You know, they do work for aviation, for helicopters, superb manufacturing company. They've got an open source plan, and they're planning to build 2,000 ventilators, some of which would be available for North Dakota, but that's again, would more than take care of what the needs that we would have here, but they might be in a position to help other places that are short. But they're not the only one in the country that's doing this. I mean, this just reflects American ingenuity. You probably have to go back to World War II to see this kind of rapid conversion of production shifting from one source to another product. But that's the beauty of the private sector. They can respond quickly and go forward, and we're super grateful for the partnership and the leadership of having great companies like that stepping up to the front. And I'm sure they'll have a lot of partnerships with people that are supplying them with those sources. But again, we have a whole team of people working on making sure that we've got enough beds, enough staffing, and enough equipment, and we're going to make sure that we're ready when that peak comes. And we've got more time than other states do, and we're going to create that gap because everybody's going to continue to apply great physical distance and slow the spread. Lane, I think this is going to be maybe our last question for today.
All right, this is for either of the senators. We had a viewer that was curious if tribal daycares were going to be under any of these benefits packages that are coming.
I'll let the Chair of Indian Affairs talk more about the tribal package, which is really important. But relative to the licensing that we announced last week and the standard operating procedures that a organization had to adopt to get the state emergency child care operating grant. Those applied only to state licensed organizations, and there are child cares that operate on our tribal lands that are licensed through a federal licensing program, not through ours, and through a respect out of that those are sovereign governance with their own licensing programs. Our grant program did not require them, because it was a requirement. If you're going to stay open, you have to use our standard operating procedures, and if you want to, you could apply for the grant. So it was an opt-in approach. If you're open, you had to use the rules, and you could opt in on the grant. If a tribally operated child care center in North Dakota wants to get licensed by the state of North Dakota and opt in, they'd be able to do that. So if they want to participate with us, they can. They're just not required to. Whether there's other federal funds that are flowing from the Fed side, either through IHS or through BIA or through other programs, I'll let the senator answer that.
So we do provide funding. As I said, the education package, I think BIA, BIE is more than $300 million. So there is funding in there, and that will go to the tribes so that they can determine how to utilize that funding. And then I would have to check with IHS to give you the guidance that they've put out for the healthcare centers specifically, and I can get that back to you.
I guess we're not cutting off questions. We're going to take one online, and then we'll do Jeremy next.
All right.
Shout it out there, Danny.
Jean Schemp with Hometown Radio in Minot. Does the state still have enough testing kits on hand to meet the growing demand? And are kits getting sent to smaller towns and more rural facilities?
Two-part question. Do we have enough test kits on site and on hand? And then are they getting sent to smaller towns? And the answer on both of those is yes and yes. The first one is, do we have enough? We're trying to keep driving the number up, so we're continuing to look for new sources of kits. There's been a lot of press since last Friday when the Abbott ID Now machine has been talked about a lot during presidential press conferences. And again, the conversation that we had before that announcement last week, Wednesday and Thursday, when I was talking with the CEO, Miles White of Abbott, they are able to identify that there were 22 of those machines operating in North Dakota. So we know the locations. One of them has been shipped to the state lab. We're working through the referencing. General Dorman and his team are working. We've got to do a software upgrade with a jump drive to all 22 of those machines. Abbott's going to be manufacturing 50,000 test kits a day for those machines. A positive comes back in 5 minutes. A negative takes 13 minutes. So you could do, if everybody was negative, about 4 an hour if you're really quick at trying to drive through those. But this is the kind of point of care testing that we're going to see more of and need more of. If we talk about down the road, how do we get America back to work? I mean, if right now in some parts of the state, we've got healthcare workers that are at home out of a preponderance of caution because they got exposed to a positive case. If we had an ID Now point of contact testing where you could do rapid testing, we could be testing first responders, frontline nurses. We could be testing them. If they're negative, they go back to work right away, as opposed to having to sit on the bench for 14 days. So great questions, but we need to keep driving forward. But on the testing right now for people that are symptomatic, the strategies we're using now, I've got what we need. Part of our conversation with Dr. Burks this morning is we again would like North Dakota to be on the front edge of not just testing for people that have symptoms, but doing testing related to what would be considered surveillance, so we can actually get better data to put into our models. That requires more test kits. The federal government is evaluating the 19 states that have had less spread and thinking about candidates that might be potential test partners. And North Dakota, we want to be in that group of potential test partners so that we could be testing in a surveillance mode, not just for people that have symptoms, because again, that would not only give us better data, but would give better data to the whole world in terms of how we manage this going forward and how we get people going back to work. Jeremy?
I've got a couple just real quick.
For these guys?
No, it's for you, actually. So I've heard from somebody who kind of feels stuck in the middle here between all the programs and new benefits here. What state and federal resources are available to people who are maybe self-employed or sole proprietors that have seen their business drop to basically zero, and do they qualify for unemployment benefits?
Well, this is why we've got to keep digging in and getting more information up through job service and through FAQs, because these guys have done such a great job. I'll maybe let some of these guys comment, but they've expanded the benefits for sole proprietor and self-employed in ways that's never been done before.
That's the right answer.
Okay.
It's the Pandemic Unemployment Assistance Program, self-employed.
Come on up to the microphone here, you guys. Come on up, Jim.
The group you're asking.
Everybody you're
So,
asking.
yeah, it's called the Pandemic Unemployment Assistance Program. It's self-employed, independent contractors, and those with limited work history who would be unable to work due to COVID-19. Sorry?
And that's part of the stimulus package.
Yeah, but I would also, Jeremy, that also applies to the Paycheck Protection Act. So if you're a sole proprietor or a sub-S with a few, just a few employees, 1099, we still want people to stay in business. We still prefer them to have a paycheck as opposed to an unemployment insurance check, if that's at all possible. That was the goal of it, as you might have heard and the governor referenced. I mean, there's some controversy over the perverse incentive of a very generous unemployment insurance program. Even though it's largely run state by state, this bill was generous for good reason. I mean, the main goal of the bill was to get money in the hands of consumers and spending, but the first goal is to keep them employed. So all of those same people that qualify for that insurance, unemployment insurance, also qualify for the Paycheck Protection Program.
And then, Governor, the last one I have for you. I don't have perfect attendance here, so forgive me if we've covered this already. But have you thought about issuing anything stronger than a recommendation for limiting crowds of more than 10? We've seen this in other states. You mentioned that this weekend the weather got nice and some people went out and had parties along the river, for instance.
We'll continue to monitor that day by day. I know that other states have put in, tried to put in limits of 5. In an extreme case, I heard of one place that said they were doing a limit of 2. That's a pretty small group. But we are sticking with the limit of 10 right now. We just want to see people respect that. That's what we want to do. But if you're 10 folks that are getting together to go for a walk or go exercise, do something, you still have an opportunity to practice social distancing if those people aren't part of your immediate pod, if you will, that you've been exposed to for recent time frames. So again, still always good to practice that. Okay, online over here, or is that the wave to end, or is it? Okay.
For the senators, for those who are currently out of work due to having been exposed to or actually contracting COVID-19, do they qualify for unemployment, or is there some other sort of relief in the package for them?
Yeah, absolutely.
They do. Remember, the second.
The question was, if you're unemployed due to COVID-related, absolutely you apply under the new bill for unemployment.
Yeah, I mean, that was actually in the second bill, the Phase 2 bill we passed, started that, and then we added more to it in Phase 3. And there's an additional 13 weeks of unemployment insurance beyond what the state typically provides to make sure those folks are covered.
It's a great question, though, because I said a little bit ago, the program's largely run by states, and all 50 states have their own set of rules for qualifying but this bill did relax a lot of that and tried to create a more universal, and missing work because you have to, because you've either contracted the disease or you have been in contact, is eligible in all states.
I'd add one more point on that. One more point on the unemployment insurance. We tried to set it up to try to keep businesses and employees together. That was the goal. So the unemployment insurance benefit, that $600 is provided on top of what the state typically provides. What we were going to try to do was make sure that you earned basically what you would have earned had you been able to stay employed. But we couldn't do it because every state has its own unemployment insurance system. So we ended up, having to pick a number. For some states, it would be lower because they're really high wage states. For others, it will be higher. But that's why it worked out that way, which isn't perfect, because our first goal was to keep employers and employees together. But that being said, it certainly provides a benefit that's going to help people. And at the end of the day, that's what this is about, is helping people, get through this coronavirus pandemic.
Absolutely. Did we have a? Danny, last one. Is that what we got?
Sure.
Coming in.
Renee Jean with the Williston Herald. In the oil patch, there's a number of employees who are traveling in from states such as Texas on a 2-week on, 2-week off schedule. What are your thoughts about their potential for spreading COVID in that area?
So coming from Renee, Williston Herald, oil workers, 2 weeks on, 2 weeks off. What's the possibility for spreading? I think one thing when we're trying to get the whole state of North Dakota to understand that we've got coronavirus, we should think of coronavirus being everywhere in our state. We should think it being spread that you can get it anywhere. And you know, an example that really hit home for me today, I read a story about in the state of Washington where after the coronavirus had been identified, a church choir group decided to get together. Somebody sent out an email and said, hey, I'm going to be there. I hope you're going to be there too. They had about 60 members out of a 100-plus person choir show up. Now 35 of them have tested positive. The majority of the choir was over 65. 3 of them have died. So it turned out to be a deadly choir practice. Even though they administered hand sanitizer when they came in the front door, they had twice as many chairs, so they were spread out. They were sort of 3 feet apart, not 6 feet apart. So again, this is part of this message of we have to take it seriously, and there was unknown whether there was people that traveled from out of state or it was just community spread that brought it into that setting that night. And I think there's a lot of focus on people coming into North Dakota. We have to be cautious about that, and that's why we've got the self-isolation order that we put in when people are coming from those hotspot states. But there are exemptions for essential workers, and the energy industry is essential. We have to keep the energy business rolling, but the same rules would apply if you are not feeling well and you're an energy worker that's here for 2 weeks. Your employer should be having rules that say don't show up to work if you're not feeling well because they don't want to get other people sick that are on the job. Every employer in the state and in the nation right now should be really focused on protecting their own workforce and enforcing these rules as well, not the government. And again, we've got the virus is here. And so we want to do the things that we can do to stop spreading it here. So again, if an oil worker comes in or somebody's coming on an H-2A visa that's coming here and they're going to be working on spring farm labor and their entire job doesn't put them in contact with anybody else within 6 feet, that's different than if somebody's coming here, coming here to work in a healthcare environment. And if people are coming here to work in a healthcare environment from out of state, I know from all the discussions I've had with healthcare leaders, they're testing those people before they put them on the line, which is appropriate to do that. So it varies by circumstance, varies by industry. Our orders in place, and we ask that people follow them, and we ask that employers as well take these things really seriously. And if we hear of non-compliance, we're in that point of this battle where we have to fight this. Somebody asked me today, if it's a football field, where are you? And I said we're on the 20-yard line. But then I said, but we're not in the red zone. We're on our own 20-yard line. We got 80 yards to go. Our curve is still going up, and we could be, weeks and weeks away from where we can get to the peak. And so this is the time frame where we can save lives down the road by really following the guidelines that we have in place now. So again, I just want to close with gratitude to everybody that is following the guidelines. We know that it's tough. If you might feel well, but you got exposed to somebody who's positive or someone who's presumed positive. Those people around those positive cases, that kind of containment around those positive cases is probably the most effective thing we can do. And so really appreciate everybody following the guidance. I want to again thank the 2 senators that are here for the great work. As you heard today, I'm sure we could go on for another hour talking about all the amazing elements that are in this federal legislation, all 880 pages. Yeah. So anyway, there is anyway, we appreciate everything that's going on in D.C. And I want to give a shout out at the end of this hour and 20 minutes to Lindsay, because she's indicated today that she can sign in federal legislation. She's able to sign in federal legislation. Very wonky signing that she was doing to keep up with you guys there. So thank you, Lindsay. Thanks for everybody that's watching. Thanks for the press, and stay healthy.